Weber.
Well, thank you, Madam Speaker. It's a joy to be here with you today and my colleagues in support of Bill C-83, which amends the Corrections and Conditional Release Act. And I've heard some of the debate this afternoon, and I would say that we all share the goal of safe communities, and we all want to be secure in the knowledge that when an offender returns to their community, our correction system has done their job, supported their rehabilitation, prepared them to lead safe, productive, law-abiding lives. And for the correction system to succeed in that regard, safety and security have to go hand in hand with rehabilitative programming and treatment. So today, I'm proud to stand here and know that that principle is at the core of the bold new measures that the government is taking to transform federal corrections. Bill C-83 will strengthen the federal corrections system, making it safer and more effective at rehabilitation, and the bill will end the practice of segregation. It will establish structured intervention units, or SIUs, to safely manage inmates when they cannot otherwise be managed in the mainstream inmate population without denying them access to programs, intervention, and treatment. And C-83 will also enshrine in law the principle that offender management decisions must involve consideration of systemic and background factors related to Indigenous offenders. And it will strengthen health care governance, allow for the use of new search technologies, and enhance support for victims at parole hearings. Madam Speaker, key to this landmark legislation is that with SIUs, the practice of segregation will become a thing of the past. Currently, if an offender is considered dangerous to themselves or others, or is at risk of being harmed, they can be placed in segregation if there's no other reasonable alternative. And segregation has remained a common practice over the years. In fact, recent policy changes by the Correctional Service of Canada led to a significant decline in segregation placements from over 700 on any given day a few years ago to just over 300 today. But we can't ignore the fact that the practice remains subject to criticism in and out of the courts. Stakeholders, including the Office of Correctional Investigator and Offender Advocacy Groups, have raised concerns about its effects, particularly on inmates suffering from mental health issues. In the court's recent decisions in both Ontario and British Columbia called for legislative reform to the practice, and they've called for the improvement of provision for mental health services within corrections institutions. And all of this is on top of class actions and human rights complaints. At the same time, others have argued segregation is necessary to ensure that correctional institutions remain safe for employees and for people in custody. The safety of correctional staff must always be an overarching consideration. Our correctional institutions are full of dedicated, hardworking staff who work long hours in sometimes very challenging circumstances to make a positive difference by promoting rehabilitation and protecting communities. And until now, they've had very few alternatives to segregation when isolating an inmate for security or safety reasons. But we now have an opportunity to address this problem. Bill C-83 will eliminate segregation altogether and establish structured intervention units. And these SIUs will provide the necessary resources and expertise that can address the safety risks of inmates in difficult circumstances. They will help to manage offenders who could not otherwise be managed safely. In an SIU, an inmate will receive structured interventions and programming tailored to their specific needs. Every day they will have a minimum of 4 hours outside of their cell, and that will include at least 2 hours of meaningful human interaction. In the existing segregation system, by contrast, people only get 2 hours out of their cell and little or no meaningful interaction with other people. With C-83, offenders will have the ability to work towards the objectives in their correctional plans thanks to a focus on interventions, and they will have daily visits from healthcare professionals. Ultimately, the idea is to facilitate safe reintegration into the mainstream inmate population as soon as possible. And to that end, placement in SIUs will be subject to a robust system of review. An initial review will happen within 5 days by the institution's warden. And if the person remains in the SIU, subsequent reviews will be done by the warden after 30 days and by the commissioner every 30 days thereafter. Also, at any time, a healthcare professional can recommend a change in conditions or a transfer out of the SIU. And importantly, The bill also enshrines in law the principle that healthcare professionals within correctional systems must have the autonomy to exercise their own medical judgment. And as recommended by the Ashley Smith inquest, it creates a system of patient advocates who will help ensure that people get the medical treatment that they need. And so for all these reasons, Madam Speaker, Bill C-83 represents a substantial change in the right direction. We have an opportunity to act now to improve correctional outcomes, to reduce violent incidents, and to ensure a safe environment for inmates, staff, volunteers, and the institutions as a whole. And we have the opportunity to contribute to community and to public safety by supporting new bold proposals that assist with the rehabilitation of offenders, reducing the risk of reoffending, and keeping our community safe. So I urge all members to join me in supporting these very important changes. Thank you, Madam Speaker.
Questions and